This video will show you how to properly add medications to your TPN bag. Please follow all instructions shown in this video. Adding medication to your bag of TPN can be safe and easy with proper instruction. Your home health nurse will be available to instruct you on the procedure following discharge and will visit weekly and as needed for your catheter dressing change and any labs that your doctor has ordered. Remove your TPN from the refrigerator 4 to 6 hours before administering. Place the TPN bag on a clean, dry surface to warm to room temperature. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water or a disinfectant wipe and drying thoroughly. If you were provided with a TPN placemat, arrange the placemat on the clean, dry area and thoroughly clean your TPN placemat with soap and water or a disinfectant wipe and dry thoroughly. Wash your hands for at least 20 seconds and then dry your hands. Use a separate towel to turn the faucet off. Gather your TPN additive supplies. These should include your TPN bag, antiseptic wipes, sharps container, additive medications as directed on your prescription, and syringes with needles. Check the label on the TPN bag for the correct patient name, expiration date, drug, and frequency. Inspect the bag of TPN for any leaks or particulate matter. If you find any abnormalities in your TPN bag or label, contact your pharmacy. The phone number can be found on the top of the product label. Please read the medication vial label to verify that the medication and dose are correct for your prescribed therapy as listed on your TPN label. Please read all medication vial labels. Remove the protective cap from the first vial of medicine to be added to your TPN bag. If the additive is a multivitamin, it will come in 2 vials. Wipe the top of the vial or vials vigorously for 30 seconds with an antiseptic wipe. Then allow to dry for 60 seconds. Repeat this process for any additional vials. Thoroughly cleanse the injection port on your TPN bag using an antiseptic wipe for 30 seconds. Allow to dry for 60 seconds. Repeat cleansing of the injection port with a new antiseptic wipe and allow it to dry for a double scrub. Open the package containing the syringe with needle. Pull back the plunger of the syringe to draw air into the syringe. The air in the syringe should equal the amount of the medication to be withdrawn from the vial. Then carefully remove the needle cap from the syringe. Be careful not to touch the needle. Insert the needle into the center of the vial's rubber stopper. Inject the air from the syringe into the medication vial. Gently pull back on the plunger to allow the medication to fill the syringe. Withdraw the prescribed amount of medication into the syringe as directed on your prescription medication label. Remove the needle from the medication vial. If the additive medication is a multivitamin, you will need to draw 2 vials into the same syringe. Expel all the air from the syringe by holding the syringe upright while pushing on the plunger. Make sure the amount of medication in the syringe equals the amount noted on the prescription medication label. Remove air from the syringe by holding the syringe upright and pushing the plunger as shown. Next, carefully insert the needle into the center of the injection port. Push the plunger all the way down using a slow and steady pace to instill all medication into the TPN bag. Syringe and needle should be disposed of in your sharps container. There is no need to recap this needle. Repeat for any additional additives, including scrubbing the injection port twice between each medication additive. Once all additives have been added to the TPN bag, gently rock the TPN bag several times to mix the solution. As you rock the bag, inspect the bag of TPN for any leaks or particulate matter. If you find any abnormalities in your TPN bag, contact your pharmacy by calling the phone number on the top of the prescription medication label. The color of the TPN will change if the additive is colored. It should look like this after adding multivitamin to the TPN. Remove trash and clean up area as you go. TPN supplies are single-use only and should be disposed of after one use. After you prepare your IV medications, always wash hands thoroughly for at least 20 seconds. Proper preparation of your TPN at home is important for your safety. Please call your pharmacy if you have any questions or concerns while administering the medication. We are available 24 hours a day, 7 days a week. In the event of an emergency, always call 911.